that I'm going to do is kind of start down in this position, and I'm going to take up motion in the shoulder girdle. And I want to make sure her head starts in kind of a neutral position, because that right out of the gate can cause some problems. If she side bends this way, compresses a nerve, or if she side bend away to start. Okay? When I take up the scapular depression and pull down into this position, there's two ways I can hold her there. I can hold just like this, or you'll see on this YouTube video. Take my watch off. Or you can take your hand and just fix it on the table. Some people just hold onto the table like that. Okay? And I'm going to have you scoot a little bit, just a little bit further. I can use this leg. I kind of want to get myself ready, because as soon as I start moving, I don't want to have to redo things. I can use this thigh as I abductor, or there's no reason why you can't use this one. Okay? So I start. She says she's got a headache because I've been pulling on her hair. So I start with scapular depression. Any symptoms? Feel anything?
I'm just very pressing.
Okay, so she feels pressure, just my pressure. Okay, now I'm going to take her up into some shoulder abduction slowly. Feeling anything? A little pull in here. It's getting tight, so she's feeling pull kind of in the axilla. Okay, so one of the things I could do just to kind of see where we're at, if that was her symptom, can you bring your left ear to your left shoulder? Does that affect the pull? Is the pull still there? So the pull's still unaffected. That was a deletion. I just reduced the tension on the nerve by bringing her ear towards that shoulder, right? Okay, so I'm getting up into this point, and I'm starting to feel like that's the end of her range. Okay, and I'm deciding I'm going to switch legs already. Okay, so from shoulder abduction, I'm going to add some supination. Any change there? Okay, and then I can go into the wrist hand and then more shoulder movement. So I take her fingers, just let your arm relax it, and I bring her into extension. How about now? Anything? She's still doing okay. And then I'm going to go into external rotation. And I'm feeling kind of, do I feel any tightness?
I have a little bit of that sensation up here. But
It's not changed. She still feels that pulling. So I'm going to keep going. That's okay. So I'm kind of getting to the end of her range right here. I feel the end of motion. No change. And now I'm going to go into elbow extension. And this is often where they start to feel something. But she's got good motion, nothing.
now I feel the pull my core.
Feels pull in her forearm. So let's see if can you bring your left ear to your left shoulder? Does that change it? Still there? It's still there, so I change the position of her head. Put your head back in the middle. I take this off. I let her scapula come up. How's the pull? What's the pull? What do you think the pull's from? Muscle. They just stretched her wrist. It's a normal thing, right? So that's not nerve tension. It's her wrist. Okay? I'm going to take back up. So I've kind of just evaluated that. I take this slack back up. No problem. I'm going to come, because I can keep moving into extension. Feeling anything now?
Just stretching.
More intense? Just more intense stretching. Okay? And so I'm going to bring her back into this position. I could add cervical side bending at the end. Away. Away. Not away. Away. So she bends away. Away. And I want to see how that affects her symptoms. Okay? So that's upper limb tension test 1. Okay?